this open. All right. You need to make sure that your patient's airway is open. So however you're going to open their airway, check to make sure that nothing's blocking it. All right. Whether you're doing the head tilt chin lift or the jaw thrust. Make sure that he's got a patent airway. And on doing a patient, it's always good to have the head tilted back and the airway open. It's just going to go in that much easier. Imagine that tongue's blocking the airway now. Their head's forward. You're trying to push that tongue out of the way as you put it in there. All right? It's just going to be harder for you to get it in, more painful for your patient. So make sure that their head, everything's open and ready to go. All right, you've got this ready. You've got your gel ready.
Great. You're not in the way or anything.
All right.
Stupid.
All right. Do I need to use the whole bag?
Sure. I mean,
no. All right. That one's used for several. All right. So you want to get this all the way around there.
Oh yeah.
All right. You got to get it looped up. But as you get it looped up, you got to remember it's going to be slippery. All right. So you got to have a good grip on it. All right. If you pull back on his nose a little bit, you'll get a better idea of where to actually place it. And you got to imagine where the airway goes. All right. So you get it in there and feed it in there.
Swallow, swallow.
oh shit! It stopped. Damn it!
Going in all nice.
Yeah, there you go.
You okay?
Swallow, swallow.
Swallow if you have to.
Swallow.
Take it deep, Marshall.
All right. Then you secure it.
Open your mouth.
The proper way to secure it.
You see it?
No.
It's clear, so it might be hard. Plus, this one's a little short. All right. To take two thin pieces of tape, one going this way across the top of it,
You got the tape?
and one going across the bottom, making sure that you leave that hole open and don't block it. We've had people go ahead and put it on the mannequin. They put a big old piece of tape right over it, covering both nostrils.
Are you crying, Marshall?
All right.
Yeah. You okay there? Let me get tape.
Suck
Let
it
me
up.
get tape. So
Oh yeah, I'm fine. Now when it says it's fine.
Breathe out of it.
It's uncomfortable. It smells bad.
Does it taste good?
It's pushing out.
That's good when I
Well,
swallow. When
your
I swallow-
sinuses
when
tend
I
to want to push it
swallow,
out
when I
automatically.
swallow,
That's why you have to secure it.
When I swallow, do you swallow shit?
That just went in there nice and gentle, huh?
Marshall.
Not like the first little minute, like pops in. And then once it's in, it's in.
Ooh.
Oh,
Double.
you can feel it in the back of your throat. It's kind of gross feeling.
On your uvula?
Yeah, it's you got a dick back here.
Yeah. Wonder what that feels
Put it over
like.
the hole.
Wonder what your uvula feels
All right.
like.
It does want to tend to back out on its own, whether they're conscious or not, especially when they swallow. Their tongue's pushing on it, and the tongue doesn't want it to, it wants to fall back and relax. All right? So keeping this down there, you have to secure it. Otherwise, it's gradually going to push out, and it's not going to do its job. All right? Once it's in place, secure it, then you're able to go ahead and continue on with the rest of the assessment.
Can you breathe out of that? Close your mouth. Breathe hard. Oh, that's weird.
You look good, Marshall.
You sure?
I'm liking that look.
Should have done that from
I pull it out.
I know, right? Maybe I can sleep at night.
Yank it out.
Dude, you took that like a champ.